the first important thing that I would like people to hear me say in my little simple pearl with blepharoptosis or acquired ptosis or a droopy eyelid is we got to make the diagnosis, okay? And it's simple. Now, everybody's afraid to have this conversation with the patient. Oh, by the way, do you know your lids are a little droopy? But when the doctor brings it up or the technician brings it up and just say, hey, Mrs. Johnson, I noticed that your lids are a little droopy. Do you notice that? Then we go through that process of looking at that mean reflex distance number 1 and mean reflex distance number 2. And I think it's simply put in the EMR. And I don't have to put it in there. My technician actually puts it in there for me now because I've enabled them to have this conversation, and I've enabled them, as long as they feel like this is part of the problem that patient's having, to go ahead and put the drop in, as long as they don't think it is going to interfere with anything else we're going to do with them that day. But simply put, I think it's actually us taking the time to look at the patient and saying, hey, they have an issue, then let's document that issue.